Hi, Assalamualaikum and a very good afternoon everyone. Welcome back. We are currently at the Sinar Daily's The Life and Style podcast. So today is in the month of November, what we call Movember. It's actually the month to raise the awareness on men's health. So today I am Dr. Ahmad Nazran Fadzli. I will be hosting the podcast for today. And we are so honored to have Dr. Ahmad Nazran. He's a consultant urologist from University Malaya Medical Center. So, hi Dr. Ahmad. Welcome to the show.
Hey, Assalamualaikum. Thanks for the invitation.
Okay, so you can just tell us what is this about November? I can see you have a very fancy cap there.
Yeah. November is actually started overseas. Something just to promote health awareness about men's health. Because usually, most people tend to focus on ladies' health. Breast cancer tend to receive a lot of attention. But I think the idea was to promote something about men's health. So we do it just after the October, which is usually the Pinktober. So November becomes Movember. So why I say M for men, but I also say M for moustache. So a bit late, November is almost finishing. But normally the idea is to grow a moustache during this time. Or for me, I just wear the hat with the moustache.
Okay, as long as you have the spirit, it's more than enough of that. Okay, to kick off this conversation, so we'd like to ask Dr. Ahmad regarding the current status of prostate cancer and also testicular cancer here in Malaysia itself. Maybe you can touch on about statistics, how it has evolved over the years.
Okay, so the one that has most attention so far is prostate cancer. Why? Because the incidence actually is slowly increasing. So if you take, we base our statistics based on the National Cancer Registry. So from the first one, that was about up to 2011, the incidence was about 6%. But the latest one that came out, which is 2017 to 2021, it actually was gone up to 9%. Of course, this 9 per 100,000 population. So of course, this is not to say a huge number. So to give an example, like in UK, the incident is like 74 per 100,000 in 2022. So, but the number is slowly rising. So that's why I want to focus more attention. And this is number 3 among men in Malaysia. Testicular cancer, of course, not so frequent. It's about 0.9 per 100,000 population. But the important thing is that based on the 2016 cancer registry, among men aged 15 to 24 years old, it's the third most common cancer. So that's why it's still an important thing to be aware of.
So it's more in the younger generation age
Yes,
group. And prostate cancer, I would understand that it would be more on the elderly age group?
Correct.
Yeah, okay. All right, so we know about breast cancer, we have screening mammograms, okay? So how about in terms of, because people would want to know, how do they actually, is there any screening tool and how effective it is? Because they might have heard about PSA for prostate cancer, prostatic surface antigen. So is there any specific screening tools for these two cancers?
Okay, so I go one by one. So for prostate cancer, the main screening tool that is used nowadays is a prostate-specific antigen. What is prostate-specific antigen? It's a protein that is produced in prostate cells, so not just cancer cells, but also normal cells. The thing is that it's specific for the prostate, but it's not specific for disease. So even like urinary tract infection, or even those with normal but large prostate, what they call benign prostate enlargement, also can have a raised PSA. And if your doctor does any examination or instrumentation, also the PSA can be raised. So the problem is that there's a lot of issue regarding false positive or not. So of course the general advice is that for those who are aged more than 50 years old, and also for those who have a family history of prostate cancer, then we advise the age of 40 years old to consider doing the PSA test, but after discussion with a health professional.
And how frequent, for example, if the first year they have done it at the age of 50 and then it came back like a normal PSA value, do they have to do it every year, or every 2 years? How do we go about that?
Actually, you can, based on the PSA level, if the PSA is very low, sometimes we can repeat it only after every few years lah. By very low I mean like less than 2 like that. But if it's still like a bit borderline, then I recommend like repeating every 1 to 2 years lah.
How about testicular cancer? Because it's younger age group, right? So they would want to know.
Testicular cancer, there's no specific screening test, but what we advise is very similar to what we advise for women, which is self-examination. So because the incident is in the younger age group, 15 to about 35 years old, the most common incidence range. So what we advise is from 15 years old, boys should be advised to self-examine their testes once a month. Okay, it's not that difficult. I say all you have to do, the best is when you're having a bath, just in the standing position, use your thumb and your finger. I mean, first look first, see whether any abnormality, and then examine your thumb and your finger and feel whether there's any, whether the surface of the testis is smooth or not. Okay, I mean the good thing is that we have 2 sides, so you can compare lah.
Okay, so if they feel, I would say these are the red flag and warning signs for the testicular cancer. So if they have some abnormal swelling or some irregularity, so they should be, should go to get themselves checked by the urologist. Okay, so in prostate cancer, so in testicular cancer, you're talking about they examine themselves at home and they can feel there's irregularity. How about prostate cancer? Is there any way, any early sign and symptoms, any red flag signs that they should be aware about?
I mean, the problem in prostate cancer is that there's no specific symptoms. So some can be completely asymptomatic, just that they decided to do the screening test and diagnose it that way. Or some may actually have what we call lower urinary tract symptoms, like going to toilet frequently, passing urine at night, or even more serious would be those who are having blood in the urine. Okay, so those are local symptoms, but again, they are not specific to prostate cancer. Even normal BPH or bladder cancer can have these symptoms. Or in the later stage, they can have metastatic symptoms that may spread to other places, such as bone pain, weakness, shortness of breath. But so the thing is that if you have any signs that is abnormal, then you should see a doctor, just to make sure that it's not anything related to cancer.
Okay, can they immediately go into like an advanced disease, meaning that suddenly they come with bony pain, but without having the initial symptoms? Is that possible for it to happen?
And that is more or less what's happening in Malaysia, in that if you find that in our statistics that 60% of men are presenting with prostate cancer at the later stages. So that is actually what is happening. Because a lot of men, we have the tendency to feel this is symptoms just to old age, this normal, nothing to worry about. Okay, bleeding just for a while, it will go off on its own. So we have a tendency to normalize symptoms, and as men we are a bit, generally myself included, we are a bit reluctant to go and seek health advice, okay, as opposed to ladies.
Yeah, so this is a very, very important point that we are trying to emphasize here. So the slightest symptoms that you have a bit different in terms of the urination, so should raise some suspicion. Any genetic predisposition in terms of prostate cancer or testicular cancer? I mean, in terms of these two, is it like some people say, is it hereditary? If my father has it, would I have it? Like that kind of thing?
For prostate cancer, definitely there is increased risk among families. So if you have a brother or first degree relative, I mean brother or father who have a prostate cancer, your chance is double. So if you have 2 relatives, it become times 4. Okay, so there's not, in terms of particular genes, so similar to breast cancer, there is a relation to the BRCA gene, but that one is not as a strong relation as a breast cancer.
Right. How about testicular cancer?
Testicular cancer, it can run in family, but not any particular
specific genes that is being carried. Okay. Any how do I say, in terms of the risk factors or personal habits that is associated with this, like some people might ask, does smoking increase the factor, the risk of developing it like a lung cancer? So, and any other things that is being associated with testicular cancer as well as prostate cancer?
So for prostate cancer, the thing is that they have been doing a lot of research on a lot of things. So there have been suggestions about things like smoking, alcohol, certain dietary factors like tomatoes, vitamin E, vitamin D, E, so a lot of things, but all that unfortunately to this date have not shown to have any preventive or risk effect. So even smoking is not 100% risk factor for prostate cancer, but for those out there, still don't smoke because there are a lot of other problems associated with it. But yeah, so the main risk factor for prostate cancer that is confirmed at the moment, one is age. So we know that with increasing age, the risk increases. Family history, as you mentioned just now, and also certain race. For example, the Afro-Caribbean.
All right.
Okay. In terms of testicular cancer, the risk factor mainly is for those. One is if you have previous history, because you can have both sides. If you have previous history of testicular cancer, is one.
Right.
The other thing is for those particularly in the young age where they had this problem of undescended testis. That means the testis didn't go down and usually need some form of surgery to bring it down. So those patients have a quite significant increased risk of testicular cancer.
So you're saying that the testis doesn't go down into the scrotum, and is there like particular age that is maybe for the mothers out there? Sometimes when they examine their child, I mean their baby, I mean the infants. I mean, when is the time that is there any by like 1 year old all the testis will be there down at the scrotum, or how would they detect all these things, and how would they go about after that?
I think usually undescended testis should be detected immediately at birth. So if you notice that at birth that you see that one sac is empty, then you should immediately seek attention. Okay. Of course, there's something called the retractile testis, where actually it's just like when the baby cries or something is upset, then it goes up, but after that it goes down on its own. That one retractile testis is nothing to worry about lah, because it will automatically go down on its own. But the thing about undescended testis, the importance, a big off topic, but the main importance of bringing the testis down soon is to actually to help with fertility. But even if you bring it down, there is still a risk of testicular cancer.
Okay.
But the advantage of bringing it down means, one is that of course fertility, but two is that easier for you to identify should there be any sign of cancer forming.
Because if it's higher up, then it's difficult for them to palpate and feel where
Yes.
the testis is, right? Isn't it? Okay, so so if you have, we will go with the prostate cancer first. So what would be the algorithm? For example, a patient comes to us with, like you said, LUT symptom, LUT, I mean lower urinary tract symptoms. Then after that, subsequently, we probably examine him and noted that probably the prostate is a bit enlarged. So how would we go about in terms of diagnosing it and subsequently treating it?
Okay. So this actually sounds like a medical exam, but it's okay. So basically, normally as all patients, we normally start with assessing the patient first. So we take the history examination, as I mentioned by yourself, that we examine particularly the prostate, which involves a digital rectal, where we put a finger with lubrication into the rectum to feel the prostate, because unfortunately that's the only way to feel the prostate. Then of course we take everything combined. We take the history and examination. So let's put the scenario that is a normal patient. We don't find anything on examination. So we counsel the patient to do the prostate-specific antigen test. So, and that's what I call shared decision making. So we discuss with the patient the pros and cons of doing the test and proceed. And then if the PSA is raised, depends. If it's just marginally raised, you may repeat first. But if it is significantly raised, then normally the next stop will be to do a magnetic resonance imaging, MRI of the pelvis. And then from there, if the MRI is suggestive that there is something in the prostate, then we will do what they call a prostate biopsy.
Okay.
Once biopsy is done, then we will do staging tests, which involve either a CT scan and a bone scan, or nowadays we straight away do what I call positron emission tomography scan, PET scan, PET PSMA, and then after that we take it from there. What will be the next step of treatment?
All right. So does it like all patients with prostate cancer, because they might want to know, I mean, maybe some of them wouldn't know where is it actually this prostate gland is. I mean, if you want to remove it, would it affect the entire genitalia? I mean, if you need to remove it?
Okay, so the prostate gland, actually all male are born with it. Okay, so we have it since birth, and it's just underneath the bladder, and it actually just in front of the back passage, the rectum. So I said, So the main function of the prostate is actually to help with fertility. So it actually gives the media and nutrition for the sperm to travel in when you have a ejaculation. Okay, so of course, whether we do surgery or not will depend. One is a discussion with the patient and the stage. So surgery is particularly for only localized disease of the prostate. Okay, so and of course, because of the nature of the prostate is just underneath just in between the two sphincters. Sphincters are what control your urination, so that you don't leak when you pass urine. So one of the major side effect of prostate cancer surgery is urinary incontinence. So that's where you cough or sneeze and urine leaks out after surgery.
Right.
Okay. And the other important thing, as you know, that mentioned that it's very close to the organs related to ejaculation or not. So and it's very close to the nerve that actually supplies the penile blood vessels for erection. So that's why erectile dysfunction is the other second almost 100% risk factor of prostate cancer surgery.
Okay, so from your experience, is it like one of the reason why patient would decline for a surgery? Because when you tell them these could be the side effects, I mean, like you said, almost 100%, then they decide no, they don't want to do the surgery. I mean, have you ever faced these things?
Yeah, of course. I mean, one thing is that we have to remember that they are not of the young population. So generally, most of our patients like 60 above, 70, and quite often they have other health medical problems as well. So one of the things that will turn away from surgery is one is a risk in terms of anesthesia and the operation per se, risk of bleeding, risk of other organ injury or not. But the other thing that that will turn them off, particularly in the Malay population, is the incontinence.
Alright.
Okay, because you want to perform prayers, ablution or not. So the incontinence is a turn off for some of these patients.
Okay. But it's mainly, it doesn't affect the external genitalia per se, right? It's all inside rather than outside, isn't it? Okay. It doesn't like you're not a man. I mean, I wouldn't say. Would you say like that?
It won't depend on what you define as manhood lah. So we don't. Of course, the organs are there, but of course, as I mentioned, in terms of erection, which also part of what people call manhood, that is quite commonly affected lah. By the surgery, because there are options of what they call nerve sparing surgery, where you can reduce the risk of erectile dysfunction, but that's only for certain patients where the disease is quite localized and it's not 100%.
So if they don't want to choose surgery as an option, what are other modalities that they have? I mean, if for options.
So for options of surgery for those where there are options of treatment for those with localized cancer, I think one is that self-advertisement, but you can go to the website Beat Prostate Cancer. There's quite nice videos there that can explain this to you. But depending on the stage, there are several options, or depending on the risk, because we will stratify you according to your risk, whether you're low risk, intermediate or high risk. So there actually are several options. One, sometimes we will just watch what they call active surveillance. Okay, that means that we don't do anything unless we start notice that the disease is progressing. The other option is surgery, we have mentioned. Third option will be something called radiotherapy. That means we use radiation to kill the cancer cells, of which there are two types. One is called external beam. That means you lie down on the couch and then a machine shines radiation for you for about 15 minutes and then you go home. Okay, and do that repeatedly about 20 times. Okay, and the other one is where we actually plant radiation seeds inside your prostate and treat it from the inside, what I call brachytherapy. Okay, and the last one is sometimes for patients who are not actually fit for treatment. Then we do what we call watchful waiting. That means we just don't do anything but wait until symptoms occur and treat the symptoms accordingly.
That means such as bone metastasis. I mean, okay.
Of course, now they also, online, lately there's a lot of news about focal therapy. So that's something that is an option that is undergoing further evaluation now. So, but at the moment, we're waiting for more information on that.
Right, okay. Okay, so now we want to move on to testicular cancer because it's a younger age group, so they would want to ask in terms of the fertility, when they want to start a family. So how would you, same goes like prostate cancer, how would you want to diagnose this patient? How do you diagnose? And then what would be the next step if we find that this patient is having a testicular cancer?
Okay. So the first thing is, of course, the most common presentation is a painless lump in the scrotum. Okay, and this is why sometimes a problem, because we assume that all are painless, but actually 20% can be painful. So painful we tend to attribute to infection. So even if you have been treated for so-called infection of the testis, but you notice that after antibiotic is still not resolving, you still need to see the doctor back, because it still can be testicular cancer. But most commonly, as I said, that's the most common symptom. The other possible presentation is if the cancer has spread to other places. So they can, most common with symptoms like shortness of breath.
Okay. So is it like most of the time here in Malaysia, from your experience, like you say in prostate cancer, what we can see in Malaysian population, they come to us in an advanced stage, in a later stage. But how about testicular cancer? Is it almost the same?
Unfortunately, it's the same thing as well, because they tend to come late, because most of them try to, I mean, we men don't really, not really so keen to talk to other men about our health as opposed to ladies. So I think that's one of the reasons. And we don't normally talk to it to our fathers. So that's why there's a bit of a difference.
Is there any difference in terms of if they would have come? They come to us in an earlier stage. Yeah, I mean like breast cancer, you can, if in stage 1 is very much, I mean your survival rate is very good. But how about testicular cancer? Would they be able to live like normal and be free of the disease?
I mean, the good thing about testicular cancer is that even at the later stage, there is still a chance for cure. Because it can be quite sensitive to the treatment. So even if you are spread to other places, but of course, the more advanced it is, the smaller the chance of that happening. So if they can be picked up early, some just need minimal treatment after the initial surgery, and then after that they can be disease free. So the aim is, of course, to pick them up early.
But testicular cancer surgery must be the mainstay. I mean, no other options. I mean, the first line of it. Would you say that?
The first line usually is surgery, and because that will remove the disease and also tell us what type of testicular cancer is it. Right. So, but of course, there are certain cases where patients come in with very florid disease, where they come in with sometimes with acute shortness of breath, because they have multiple lesions in the lung. So in those cases, sometimes we have to give the chemotherapy first, and then only later we do the surgery to remove the testis.
Okay. So yeah,
but at some point or another, they will need that surgery.
Okay, all right. So that's the difference. Like somehow, whatever it is, you still need to remove the testis at one point. Okay. So the question would come: so if you remove the testis, what will happen to them? So I'm sure you've been getting all these questions.
Yeah, I'm sure it's an important question, because you have the younger people who want to have family. Okay, so the thing is that sometimes it's not of course you remove one testis, but even if you remove one testis, most of the time the chance of you to have another child, to have children, is the same. The key thing that may actually affect your what they call paternity rate and fertility rate is actually the chemotherapy, which is quite commonly given afterwards. So that is the thing that is had to watch out for. So that's why most of the time patients, ideally before we take out the testis, but definitely before you start chemotherapy, we advise for what they call sperm banking. Okay. So sperm banking is not in any local bank, but this one in certain centers, like for example my center, University Malaya, thanks to Prof Mokris, we have a sperm banking facility. So they actually store the sperm in liquid nitrogen at very low temperature. The temperature now outside is about maybe 30 degrees, hopefully not raining, but for the frozen one it's actually minus 198 degrees Celsius. So it's extremely cold. So and they can actually keep the sperm for a long time, for about 40 years.
Right.
So that just in case you are one of those who the chemotherapy affects your sperm production, you can use the sperm to get children using assisted fertilization techniques.
Right. So you were saying that we have to, preserve the sperm prior to the surgery itself or prior to the chemotherapy?
Okay, most of the time the prior surgery part is a bit difficult because most of the time we want to do the surgery as soon as possible. But
Okay.
ideally, from research, it would be best if you can research before surgery. But if not, after surgery also is fine.
Would it affect in terms of the type of sperm? I mean, when the patient have testicular cancer, I mean, then they might have an anomalies in terms of the sperm.
No,
It's
not
not related in terms of that.
related that way.
Okay, because they wanted to know. I mean, so like Dr. Ahmad have already mentioned, it's not like you have two testes, you remove one, your like chances is 50% down. It's not
No,
like that,
not
right?
like that.
Okay.
But the key is the treatment afterwards.
Okay.
That will affect your fertility.
All right. Okay. So, so mainly for testicular cancer, the aim of the treatment would be you will do. I mean, if you are fit and it hasn't spread to elsewhere, you do a surgery. Subsequently, after that, you preserve the sperm, and after that, going for chemotherapy. And you can, I mean, after that, you can just live as normal. Should be, it wouldn't affect your daily life, isn't it? Okay. So how about the follow-up? I mean, do they have to do ultrasound every now and then? You know,
So
like the
this one for
breast?
testicular cancer, so depending on the stage, of course, depend on what treatment you do after you have removed your testes. So that can be a range of things from chemotherapy, radiotherapy, or what they call more surgery where they remove the lymph nodes around the large blood vessels of your body, what they call retroperitoneal lymph node dissection. Okay, so after that, of course, all these have its own morbidities as well. So that's you have to follow up for that. But otherwise, the good thing about testicular cancer is that you can actually monitor most cases using blood tests. Okay, so you can actually, so what we do normally in the early stages, we will monitor with examination. Okay, so the patient come to clinic and then we examine about every 3 monthly at first, and then we also do the blood test related to testicular cancer. But at the same time, the patient is advised to learn self-examination of the other side of the testis.
All right. Okay. How about the prostate? On the other hand, I mean, the follow-up would be still the same. I mean, do they have to do ultrasound? I mean, if their prostate is still there, I mean, how would you go about with that?
So normally we don't because in most cases in prostate cancer we can base on the prostate specific antigen PSA test. So
Okay.
monitoring will be with that lah.
Okay.
And then if there's anything that we feel need further imaging, then depend on the scenario whether we do the PET scan or we do the MRI.
Okay. All right. All right. Can you share a little bit of any interesting cases that you have in University Malaya? I mean, like in regards of this testicular cancer or prostate cancer, anything which strikes for you which is interesting or different as compared to the normal present, or they might present to you differently, and then you investigate and then got to know that it's actually having either these two cancers.
I think the I won't say interesting per se, but I will say it's a bit worrying per se.
Okay.
That we are seeing, as I said, usually we offer screening at more than 50 years old, but we have some patients even at 30 plus that were found had a raised PSA, did the MRI, found something, and then found to have prostate cancer. So that's a bit worrying thing that generally not just among but I think also among other cancers in Malaysia, we are seeing the patients getting younger and younger. Okay, so that's I won't say it's really interesting, but it's worrying. But that's for prostate cancer lah. In terms of testicular cancer, the presentation can be quite varying because we particularly I had one patient last time where he didn't. We have some patient last time where he had both sides had testicular cancer. So
At
we
the
had,
same time?
Yeah. Wow. So I had to do one part, had to take out the testis, the other side, where I took out just part of the testis to try to preserve his because the testis not just about fertility but also produces the male hormone testosterone. So the main aim was to try to preserve that lah. Because if you don't have any testosterone in your body, then you feel a bit like a lady with menopause lah. Because you don't have that hormone driving you, so normally they will need to be on supplementation for that. So to avoid that, we tried to do a partial on that side lah.
Okay. So like for example, like your case, you said you did a partial removal of the testis on the other side. Then is there any like at a certain age, once he's already like probably 40 years old, then you go for a total, like remove the entire of the
I
testis
mean, not really, because you need the hormone testosterone for the
for the rest.
for the rest of your life. So it's not just about the fertility part. But he already, if I remember correctly, already completed family lah, so he was not so worried about the fertility part.
So, is there any misconceptions, I would say, in our, like some myths, some legends that patients only come to you ask this? Any misconceptions that you have seen patients asking, or like people have been talking about regarding prostate cancer or testicular cancer that you want to like highlight to all the audience out there?
So I mean, there are a few myths lah. I mean, for testicular cancer, not so much, but the one about prostate cancer. So one of the things that have been going around is that this study saying that if you frequent ejaculation prevents prostate cancer. So I mean, it's true. The study was done, not denying that, but there are other studies to say otherwise. And the problem with these studies is that it's a bit difficult, because you're asking a man, because this is how they did it. You're asking a man 20 years ago whether he can recall how many times he ejaculated per day. Okay, so generally men sometimes may tend to over exaggerate. So I'm not so sure about the accuracy of the thing. So I would say, of course, we recommend a normal healthy lifestyle, but I cannot condone frequent ejaculation per se until we got further evidence to support that. Okay. Other things I say is that some people say that if you there are a lot of people now going to cycling since COVID. So they say that if you are using on the cycle, because the seat, I have to admit, is not the most comfortable, but then that increases the risk of prostate cancer lah. But so far, no evidence for that.
No evidence.
So you can continue cycling if you want.
Okay, so just now you did mention regarding in terms of men, they don't really want to talk about their health or if there's any problem. How, in a way that probably your institution or in general Malaysian, the NGOs try to help in terms of like making these people more open and open up to their issues, maybe men's issues. What would you have to say about that?
I think what we've been doing for quite a few years is try to have all these health awareness events. We have every yearly, even Ministry of Health as well, universities, we have all these prostate campaigns.
Okay.
We try to increase awareness. But saying that, even the Ministry of Health also are working on almost finished the document talking about how to screen, what's the procedure for screening PSA for patients with urinary tract symptoms, so that there is a fixed regime of how you do it, so that to increase. And recently, led by Professor Ong, University Malaya also are doing something about a policy brief to try to improve about prostate cancer detection in Malaysia. So there are some things that are in the pipeline to try to improve the awareness. But generally nowadays, things like this kind of podcast, social media also is a very powerful tool. But the only thing about social media, you need to check that it's correct. Not everything is correctly 100% true. So you need to double check sometimes.
It has to be reliable, not just someone just post it on the social media to attract attention. Is there any resources, like you said, University Malaya had some from Prof Ong did some awareness. Any other resources available for men? Other than online. Any NGOs that you would know, or any anywhere that could actually find information or resources on testicular cancer in terms of other men's health?
I think you can visit any doctor, any GP clinic. They will have information on that. Okay, and as I said, I've mentioned online. There's a lot of things you can do. Website like National Cancer Society, Big Prostate Cancer Malaysia, Big Prostate Cancer you can visit. But the other thing to say is that we have, particularly for those who are diagnosed with prostate cancer, we actually have a quite strong prostate cancer society in Malaysia.
Okay.
So that's the other thing, and they're very approachable. They're more than happy to give their phone number.
Okay.
You can converse with them. Led by Mr. Wong.
Okay.
So it's quite a friendly society. So if you have any queries, they're also happy to help.
So it's like a support system.
It's actually a society made by prostate cancer survivors for prostate cancer patients.
Right.
So it's quite a strong society.
Okay. All right. So is there any I would say lifestyle modifications that you would actually advise, not just in terms of testicular or prostate cancer, in terms of general men's health, because we are talking about November itself. So men's health in terms of like in a vast. So any take-home message or any advices that you would give to the men?
Okay. First advice I say just live a general healthy lifestyle and don't assume, don't take any symptom for granted. So if you feel anything is wrong or abnormal, then you should seek contact from the doctor or your local GP. The other thing is that be a bit aware about, a lot of places they offer all these blood tests. So it's good to always discuss with someone first before doing all this executive profile, because once you have something, like say you have a raised PSA, it can cause a lot of anxiety or not. And the other thing is a message for actually the wives, because sometimes it's very difficult to get the men themselves to go. Sometimes it's important for the wives to know about this, because they are the one that may be able to push the husband to seek medical review.
Okay. So it's very important in terms of the support system. It's not just the patient per se. I think same goes to all cancer, all diseases. You are not facing it alone. I mean, I know the decision might be from the patient itself, but the family members, the society, because sometimes people would say this and that. You want to do something right, then people would just give another negative review or feedback, isn't it?
Yep.
Okay, all right. Any other take-home message you could give in terms of in testicular cancer or prostate cancer?
I mean, the main thing is that it's treatable. So like for prostate cancer, if you detect it early, like up to stage 3, the chance of you surviving 5 years is more than 90%. Whereas if you detect it at stage 4, that 90% drops to 50%. Okay, so and this is for Malaysian data, by the way. So that's why it's very important to detect it early lah. But at the same time, even if you are stage 4, it's not to the point that you need to be despair too much, because the treatment is there even for stage 4, usually in terms of hormonal agents and plus minus chemotherapy lah. So these agents are actually quite effective and can actually give you quite good lifespan as well as a quality of life. So not to despair lah. I say testicular treatment is whatever the stage is curable. So that's why again it's treatable, but you of course need to comply with the treatment and follow up given to you.
So I think that's almost all the time that we have for today. So the most important thing is that any abnormalities that you have, you must actually go and seek for medical attention, and then from there the doctors will assist you in terms of that. Okay, and what Dr. Ahmad have already mentioned, especially testicular cancer, they affect younger men, and it is curable. So please don't be shy. And also for prostate cancer itself, stage 3 disease, they still have good survival rate, isn't it?
Yep.
Yeah, so it's not, because sometimes the stigmata, they would feel that once you are diagnosed with the cancer, that's it, that's the end of your life. But we shouldn't feel like that. And as a community, and now it's a month of November, we should be very supportive of all the men out there. And okay, thank you so much, Dr. Ahmad,
thanks for
being here, for
giving the opportunity. Thanks.
For the knowledge, for the enlightenment. Okay, thank you to all of our audience for joining us today. You can listen to all the Sinar Daily discussion on all podcasts, streaming platform, and follow us at the Sinar Daily MY on all our social media platforms. Okay, inshallah, till we meet again. Enjoy your November. Bye.
Okay, bye.